Welcome everyone to Facebook Live. I'm Dr. Troy Baker, and I'm joined with a panel of two of my good friends and colleagues in the allergy department. I work at MapMG, Kaiser Permanente, and I am an allergy physician. And today we have a fascinating topic. I've been with Kaiser Permanente for about 5 years now. I live in Northern Virginia. I have a family of 4, and fortunately, my kids don't suffer from pollen allergy, and perhaps some of you do, and you're here logged in to learn some pro tips and some advice on how to make this spring very enjoyable for you and something you can enjoy while you're outdoors. So without further ado, I'm going to introduce my first friend and colleague, Dr. Adriano Salacru. He'll come on and say hello.
Hi, good afternoon, and thank you for everybody for coming and joining us. My name is Adriano Salacru, also an allergist, just like my good friend and colleague, Dr. Troy Baker. I am at the same institution at Kaiser Permanente. I've been here for nearly 7 years. I didn't realize it was that long. And live in the Maryland area. Like him, I have a family. I've got 3 kids, very active, one who suffers from allergies, so I hope she's paying attention. She'll probably learn more from my colleagues than she would from her own dad, who she doesn't listen to. So looking forward to this talk.
Thank you, and welcome, Dr. Salacru. So Dr. Steve Scranton's also joining us today. And Dr. Scranton, will you introduce yourself?
Hey, good afternoon, Dr. Baker, Dr. Salacru. I'm happy to be with you today. Yes, I'm local here too. I work for the Mid-Atlantic Permanente Medical Group here at Kaiser, and I've been here since 2013. I'm a pediatrician initially by training, and then transitioned into allergy. I got all my training done through the Air Force. I practiced all over the states and overseas as well. So I've seen a lot of the world and the allergies there. But yeah, I'm happy to have this discussion today.
Wonderful. Thank you, Dr. Salacru and Dr. Scranton. So those are watching, you're welcome to put in some questions in the chat stream, and we'll try to answer those. And so I guess I'll start off with some questions for Dr. Salacru. I'll have you start, and any of us can add our own thoughts as we like. So
Definitely.
Dr. Salacru, so can you explain, like, how do people get allergies, and what are some common signs and symptoms of allergies?
Good question. And that is the $1 million question, actually, for everybody living here in the United States and all over the post-industrialized nations. Allergies are where your body, your immune system, for whatever reason, treats what would otherwise be innocuous things in the environment, maybe tree pollen, maybe grass pollen, maybe our favorite pet, and sometimes even some foods, as a pathogen, as something dangerous. And we are starting to get some ideas as to why that happens. But for whatever reason, our body is treating these things as pathogens. And when it does that, when your body is exposed to these things, you can get symptoms. And so for us in spring, and this includes me, I'm a sufferer of allergies. Right now, I've got a runny nose. I've got my trusty paper here with me to blow my nose with. Itchy, watery eyes, sneezing. It drives my wife crazy, even my dog crazy. So I've got a lot of symptoms going on.
Excellent. Thank you. Dr. Scranton, so I'm going to ask you for the next question. So if those people who wonder if they do have allergies or don't have allergies, is it a virus? Is it not a virus? How can you figure out is there testing available? And so what are your options?
So when you're asking about allergies versus viruses and things, I think we're really talking about upper respiratory allergies, environmental allergies, that sort of question. So some of the symptoms overlap, you're right. So runny nose, nasal congestion, sneezing, that could very easily be allergy, but it could also be, the common cold or other viruses that we all know too much about these days. So there are some symptoms that kind of point you away from allergies, though. So if you're having fevers, or if you've got muscle aches or fatigue, I guess if you're not sleeping well from your allergies, you might have some fatigue. But in general, some of those things kind of maybe would make you think more about this being allergies, or excuse me, about being an infection. But sometimes it's hard to know. So, and seeing an allergist can be helpful in kind of teasing out which of your symptoms might be allergic and which not. We do have, depending upon what your concern is, we do have reliable testing for a lot of environmental allergies and foods and bee stings and things like that. Some of this testing is done. I think most people have heard of skin testing, allergy skin testing, where we bring you into our clinic, and either on your arms or your back, typically you can introduce small amounts of allergen under your skin with, it's almost like a little toothpick that we use, a little plastic toothpick, and looking to see if a local reaction develops, which would make us think, okay, this looks like you're sensitive to these ingredients. But we also, as time has gone on, we have blood testing that can be done for allergies, and I think a lot of people wonder how we can do that. How can you test your blood to see if you're allergic to something? And like Dr. Salakru mentioned before, allergies are related to your immune system, and when you become allergic to something, whether it's cat or peanut or whatever, some of your white blood cells will make a little protein in your blood called IgE that is specific for that allergen, for cat or for peanut. And our blood testing can look for the presence of this protein in your blood. And so it is, especially over time, and especially during the pandemic recently, when people have not wanted to come into the clinics as much, it is a really good way for us to be able to screen people for various kinds of allergies with the blood test, and we get reliable results with both.
Awesome. I love that. So, right. And I like the point that you made, that either option is considered equally good. There's not really a superior one, and both are very, very, very good tests. So I'm going to answer this next question. Then Dr. Salakru, your question is going to be, what are the natural ways so someone can combat allergies? And so mine is, what are the types, if you're going to the store and you're looking for medications you can buy over the counter, what are your options? And fortunately, there are a lot of good options over the counter. So if we started with something really simple, I think saline is an excellent treatment for allergies. It helps to irrigate the mucus out of your nose, wash out the pollen pollution out of your nose. And then from there, your nose is ready to receive other medications. A common, really well-known medicine is Flonase, or a nasal steroid like Nasacort. And you can use one of these or one of the competitors to spray up your nose once or twice a day. And that's going to help decrease the inflammation and decrease the amount of mucus your nose makes. So looking at over-the-counter nasal steroid sprays are helpful. And there's also a lot of good over-the-counter allergy eye drops. You have, just to name a couple, you have olopatadine, which is known as Pataday. You have ketotifen, which is known as Zaditor, but those are good eye drops you can use. You can also use artificial tears throughout the day just to kind of wash out pollution out of your eyes or pollen buildup. And then finally, you have a number of over-the-counter antihistamine pills you could consider, such as Allegra, Claritin, Zyrtec, Xyzal. There are a lot. So those are some of the non-prescription medications that you have access to immediately. So Dr. Salakru, what would be some options, like some common sense measures or pro tips that you can offer your patients to help minimize pollen allergy in their homes?
Oh, absolutely. And the kind of tips I'm going to share, I definitely share with all my patients, and I try to do them myself because I find that it works. We think of medications like what you just described, and we also try to think of marrying that with some environmental control measures. So some of the things that I do, especially for spring allergies, if I spend any time outdoors, the minute I come inside, I change everything. If you can imagine, what bees are doing when they're outside, they're collecting all this pollen. You look at them, you see pictures of them, they're just covered in all this stuff. We're doing the exact same thing. So not only is my clothing doing it, my facial hair is doing it, my eyebrows, my eyelashes, my hair. So the minute I come inside, I change right away. I ask family members who've spent time outdoors to do the same thing. I rinse my face very thoroughly, especially eyebrows, eyelashes. I try to do the same thing with my hair if I can. If I don't do these things, I can tell you exactly where my daughters have been on the couch, because I start to get symptoms and sneezing and everything. So I think doing those things help. Also changing out the air filters in our car, the air filters in our HVAC systems can be really helpful. Keeping the doors and windows closed during the spring it's so tempting to open them and get that fresh air in, but you're also inviting all that different pollen into your home. And some of the other things that I do, I have a 65-pound Labrador, lots of hair on him. And so when I take him outside for a walk, he gets covered in pollen. And when I bring him inside, I wipe him down with a damp cloth. And we still have some leftover baby wipes from back in the day, and I'll use those and I'll wipe him down as well. And that helps to at least minimize the amount of pollen that I bring inside to the house. I think you guys probably have seen this phenomenon too, right? Thanks to the pandemic and people wearing masks, I've found that a lot of people have had some less or decreased symptoms from exposure to pollen just from wearing the mask. So that can also go along with maybe wearing sunglasses, maybe wearing glasses when you're outside, wearing a hat when you go outside. I have a number of patients who washing their hair at night is not necessarily an option every night if they're pollen sensitive. So I'll recommend, okay, try wearing a barrier or something when you go to bed, because if you don't at least rinse out your hair, if you look at my pillow, it's probably covered in pollen, and I'm getting this all into my eyes, into my nose all night long if I don't do something to at least try to get rid of that pollen that's in my hair.
Those are awesome tips. I love it. And I like the analogy used with the bee, and that's exactly correct. We're like giant pollen sponges. So thanks for that. Very, very
Absolutely.
good analogy. So here, the next question is for you, Dr. Scranton. So our audience wants to know, what's the difference between an allergy shot and allergy shots? I've heard that you can get a shot once a year and do well with allergies. Can you go over that? What the question? Answer that question, please.
Yeah, so I think what the question is asking is the difference between a steroid shot and what I think we call allergy shots, but really are allergen immunotherapy injections. So steroids, we know, work really well for allergies, regardless of what the cause is. But they can have the potential for really significant side effects, especially if used often or regularly or at high doses. And this ranges from affecting your blood sugar to bone loss to affecting your eyes or blood pressure, gaining weight, et cetera, et cetera, et cetera. So there's a lot of good reasons not to use these steroid shots. And the steroid shots can help you in the short term if you're having a severe allergy flare, but it's not a long treatment. Typically the shot might last, a week, and as we all know, the pollen season, depending upon what you're allergic to, can last for months sometimes. So it's a short-term fix. It's a Band-Aid, basically. Now, if we do see a lot of people, I saw a couple today, who are tired of having these seasonal flares of symptoms, and they've used various medications, both over the counter, like we've talked about, or prescription medications, and yet they're still struggling with symptoms, and they're just tired of dealing with this. And for those patients, they can choose to do allergen immunotherapy, which is the allergy shots that we typically will do. And what that is, it's a pretty old therapy. It's been around for over 100 years. It's a pretty natural therapy. You actually get injections with the stuff that you're allergic to. So if you've got cat dander allergy or birch tree pollen allergy, you would actually get injections with purified versions of those extracts. And the downside, although it works very well, the downside is that it's a big time commitment. So when we're talking about allergy shots, we're usually talking about a course of 3 to 5 years. And the beginning of the allergy shots is really the hard part, because you have to get a shot roughly once a week for about 6 months. You can go a little faster if you come in more often. It'll take a little slower if you come in less often. But if you come in once a week for 6 months, that will get you to your top dose. And then finally at that top dose, you can start spacing it out for up to a month in between injections, which is a lot more doable for most people's schedule. But they work great. Most people get 80% or more improvement of their environmental allergy symptoms. Very helpful. Allergy shots can be done for other purposes, like bee sting allergy, for example, and for that they are extremely effective. And bee sting allergy shots are probably one of the biggest helps that we as allergists can do. It decreases your risk of severe allergic reaction from about 60 to 70% with each sting to down to 2%. So it can be life-saving. But long answer to your question, but yeah, steroid shots versus the environmental allergy shots or bee sting shots, very different. It's a long course, the shots that we typically do in our clinic, but very effective and very helpful. Yeah, it's a good option for people who are struggling with symptoms.
Great, that's excellent. And I'm glad you even brought up the venom part, like with bees or insects. Also, allergy shots you made me think of can also incorporate things like dust mites, cockroaches, feathers. So there's things in your environment that often can go into allergy shots
Absolutely.
as well. Great, thank you. Dr. Salacru, one of our audience members would like to know, how do you distinguish between COVID viruses and allergies? Is there some telltale signs that we can use as patients?
That's a great question. And to be honest, it can be both complicated and easy sometimes. I think most of the time it's not quite obvious. When we think of allergy, there may be some sort of a seasonal pattern that we see over time. So I'd say your history of symptoms is really what's going to determine how we think about, is this allergy related? Is this infectious related? If it turns out that, oh yeah, every spring I have these symptoms, I've been having them for a number of years, in our minds, we're going to be thinking a little bit higher of allergy. If it turns out, you just recently had some travel somewhere, or maybe your kids are back in school, they just went back into daycare, and you're noticing new symptoms. It may be happening in spring. Could it be allergy? Absolutely. Could it also be infection? We would definitely think about that. And so a lot of it, I think, depends on your history. So if you personally are just having a runny nose, I would think broadly. Yeah, could this be infection? Could this be allergies? Absolutely. Especially if you're having things like fever, or maybe some people might even have sinus pain, sinus pressure going along with that, with fever. That would really make us think more infection.
Great. That's very simple. I love how you phrase that. Thank you. Okay. Dr. Scranton. So an audience member would like to know, can allergies cause problems with other parts of your body? And they're mentioning asthma or pink eye or red eye. Like, can you comment on that, please?
Yeah, so certainly, if we're talking about these environmental allergies, yes, it can be a trigger for asthma type symptoms. Really, anywhere this pollen or dust or pet dander, anywhere this touches, it could potentially cause problems. So, yes, we think about the nose, the eyes, the lungs. Sometimes it can be a trigger for eczema in some sensitive patients as well. So absolutely, yes, it sure can.
Okay, awesome. So Dr. Salacru, can you develop environmental or seasonal allergies? What's the typical age you might get them, and can you grow out of them?
Very, very good questions. I think a part of it has to do with our developmental anatomy. So we, of course, young kids can have a lot of these symptoms, but we tend to see that after around the age of 2, they start to develop these air pockets in our bone structure, what we call sinuses. We have a number of them. As they develop, roughly around 24 months of age and beyond, we start to really see the potential development for allergy. The immune system is now sampling the environment. Is this a threat? Is this not a threat? Is this me? Is this not me? And around that time is when we really see it. So, but it can happen at any age, I suppose, but that's really when I see most of it. And it tends to happen a lot when we're younger. And, to the question of, can they get better with age? I think it does get better with age. Other things tend to replace allergies, unfortunately, as we age. But we do see that some things do get better with age. And I'm sure my colleagues have probably seen this phenomenon too, where periodically people will have these awful allergies to maybe some pets, but not all pets. And over time, either by skin testing or by blood work, we can see that actually gets better. But maybe they develop new things. So in general, yes, things do get better.
Perfect. Good, very good. So there's some questions. We're going to change gear here. We're going to move into food allergy. I'm going to answer the first question, and then there's another question I'm going to lead with Dr. Salker. I'm going to have you do the next one. So first question is, can you get out food allergies any time of your life? And the simple answer is yes. You can develop food allergies at any age. And most of the time, when you get a food allergy, I'd like to point out it's usually pretty obvious to the parent or to the person. For example, so if someone comes in to see me and they're an adult and they ask, do I have food allergies? Generally, the answer is probably not. If you're asking if you have food allergies, likely you probably really do not. You might have a food intolerance. There may be something that the food is doing that makes you feel uncomfortable, whether you're bloated or fatigued or tired or have a migraine or a headache or developing acne. Perhaps there's a link with food, but when we use the word food allergy, we're looking at something that's repeatable, predictable, reliable, which means if you eat the food, you know something's going to happen. And it's usually going to be itchiness, hives, lip swelling, face swelling, shortness of breath, and it will happen every time you eat the food. So I do see kids under the age of 1 develop food allergies. That's not uncommon for us. And usually they will manifest that by throwing up immediately after they eat the food or get hives or a rash very quickly after eating it. So yes, the answer is you can get a food allergy anytime. And I think it's also important to note what the difference between a real allergy is and maybe a food intolerance that your body's just not handling well. Let me ask Dr. Scranton one question, then I'm going to go to Dr. Salacru for the follow-up. Dr. Scranton, is there any commercial tests that you can recommend to patients to find out what a food intolerance is, or what would your thoughts be for that?
Yeah, that's a you're asking lots of good questions, but that is a good one. That is a question that we get a lot, and unfortunately, no, there's not really good testing for any food intolerance, with the possible exception of gluten intolerance. There's a blood test that can help us a little bit identify that. But despite that, you're exactly right. You do see these products out there at CVS or the grocery store, and I'm not going to name names, but a lot of these tests are based on IgG testing for foods, which if you remember before, I was telling you about the proteins in your blood that are associated with allergy. Those are IgE proteins. These are different kinds of proteins, but some people have decided that having IgG proteins for certain foods in your system is a negative thing or an abnormal thing. And they have taken that to mean if you have the presence of these IgG antibodies to whatever, egg or milk or whatever, that's an abnormal thing. You should avoid those foods. That indicates you're intolerant to those. But our allergy societies do not agree with that. And in fact, we think the presence of IgG to foods is actually a sign of a healthy immune system. It's just that your immune system has seen these things, recognized them. They're nothing to worry about. It's just there. But unfortunately, these companies are out there, and I personally feel like they're preying on a vulnerable population, and these tests are hundreds of dollars. So it's not something that we offer, and we don't offer it because it's not it's clinically useful. It's not helpful in determining whether you're sensitive to something or not. And I wouldn't recommend that you go out and pursue it on your own. So if you are having these symptoms, like you mentioned before, Dr. Baker, about the bloating or stomach issues, or these, certainly there are other specialists who can help you address those issues. And I wish there was a great test. It's kind of a gap in our ability to help patients, I feel like sometimes, but because there's a lot of people with food intolerance out there, but not good testing for it, unfortunately.
Well, that was a great answer. Thanks for walking us through that. So Dr. Salacru, the next question, we're going back to what we were talking about before, but why does my throat itch when I eat certain fruits and vegetables? Do you want to cover that for us, please?
Oh, I'd love to. And in fact, we might put up an image that I think helps to explain it. So when people are really sensitive to certain pollens, I think of tree pollen, grass pollen, weed pollen. And of the trees, I think of birch being very closely related to oak and beech. ragweed and mugwort being two types of weeds, even though mugwort sounds like something out of a Harry Potter novel, and orchard and timothy, two types of grasses. So when people are sensitive to these particular pollens outdoors, and you may know it, you may know that, oh my goodness, in spring, depending on early or middle spring, or maybe even in fall, you have these awful nasal eye symptoms. But you may develop this phenomenon and may not think about it initially until it really becomes overt. You may get an itchy mouth, itchy throat, whenever you're eating something like, say, a raw apple, raw pear, raw peach, raw stone fruits, raw carrots, raw celery, even things like raw soy and raw peanut and raw hazelnut, almond. For others, it could be eating a banana or some of the melons. For some people, I get a lot of individuals with awful grass allergy, and they have a very itchy mouth and throat when they eat oranges, or they have a fresh oranges or French orange juice. And so what is this? And people notice that if they have that raw apple and they have those symptoms, but they don't have it when it's either been cooked or processed. So raw apple, not always useful for them, but if they have apple pie, apple sauce, apple butter, they seem to be perfectly fine. And the phenomenon that's going on here, it's what we call a cross reactivity. The protein in the foods and these particular fruits and vegetables look so similar to the protein and pollen that when you're eating those raw fruits and vegetables, your body thinks you're eating pollen. It doesn't know the difference. And it's not the surface of the fruit, so you can't really just wash the fruit and that'll be that. The protein is embedded throughout the whole fruit. And so some of the things that I recommend to my patients, and I say this as an amateur chef, I love to cook. So if you take a raw egg and you look at that egg white, that's just pure protein. But if you can do things to that pure protein and change the way it looks to the body, that's exactly the strategy that I would use with the different fruits. So with that egg white, you can add heat to it, and you'll notice that egg white goes from clear to opaque. That's a denatured protein. You can do the same thing by maybe taking that egg white, putting it into a bowl, and put some mechanical energy into it. Whisk it up really well, like a Jacques Pepin video or something, and you'll notice that egg white turn into a meringue. And you can also do something similar. I'm sure somebody like Bill Nye, the science guy, or Neil deGrasse Tyson would probably add lemon juice, and that acid will also change the way that egg white looks over time. It'll actually cook it, just in the same way that we quote unquote cook raw fish with ceviche. We're using the power of that acid to change the fruit. So what I do personally, because I happen to have this syndrome, I either have the foods cooked and or processed, not always fun for people who are fans of fresh raw apple, but I can also take that apple, cut it into slices, squeeze lemon or lime juice over it. And not only does it keep it looking fresh, it keeps it from oxidizing in the atmosphere. That acid is changing that protein. So my body no longer recognizes the fruit as pollen when I'm eating it.
That's well said. And I love the figure you shared with us. I think a picture really helps cement that idea. So thank you. Okay, Dr. Scranton, for you, I often have heard that eating local honey will help reduce my pollen allergy. Can you talk about that question, please?
Sure. Yeah, you mentioned earlier, Dr. Baker, some of these kind of natural things that we can do, saline flushes, for example, to help kind of clear out your system. But there are some who feel like using local honey, so the thought is that you, like Dr. Salakroom was mentioning before, these bees go around, they collect the pollen from these flowering plants here, and if we take that honey that's made from that pollen, that is kind of a less scientific way, I guess, of maybe doing an allergy treatment, like the allergy shots I was telling you about earlier, the immunotherapy. And I love the idea of it. And certainly it's not harmful to do it, but it's not helpful. I wish it was. So there's two major kinds of pollen, I guess I would say. So they call them entomophilous and anemophilous. And what that means is that entomophilous means that they are insect pollinated. That's the bee example. And then you have anemophilous plants, which are wind pollinated. And the pollen that triggers the bothersome symptoms for us is anemophilus. It's in the wind, it's in the air. It's the stuff you can't see. It's microscopic. You can't see it with the naked eye. And the stuff, that big fat yellow pollen that you see on honeybees or on your car, that's not typically the stuff that's causing you problems. That stuff is too big and heavy to stay in the air, and it drops to the ground. And so on the ground, it's not, you know, touching your eyes or nose, or you're not breathing it in, but it's the stuff that's blowing in the air. So it's the wrong pollen is the short answer to your question. So I wished it was helpful, but it's not.
Great, thank you. So I'll answer this next one. An audience member would like to know, like, can I get away from allergies by moving to a different region of the country? And so the answer is maybe. I would never relocate just to get away from pollen. You have to recognize, so I trained like Dr. Scranton in San Antonio, Texas. And so San Antonio is a fairly warm climate year round, and it has very long pollinating seasons. And so there are certain trees like the mountain cedar tree that would pollinate in the winter time and cause a lot of problems from anywhere from around mid-December to around Valentine's Day. The mountain cedar would pollinate pretty heavy and hard. And so, but if you move somewhere else like California, you may not see the mountain cedar tree pollinate in the wintertime. However, you may find that there's a different tree that's local to that area that you may have an allergy to, such as maybe a palm tree or a olive tree. So definitely don't relocate just for pollen. And yes, there may be some states that are more desert that may not have the type of tree or what that you're allergic to, but there are a lot of good options to treat your allergies before you consider moving. So that's my answer for that. Okay, so Dr. Salacru, can you comment on, do allergies ever go away with time? I know you talked about this before. Penicillin was also asked in the same question. So do you want to comment about that?
Yeah, there are some things that do go away with time. Allergies to things in the environment, what we call inhalant allergy, does get better with time, at least for a good majority of people, and even some medications. So for people who are allergic to penicillin, and this is probably something that's very popular, especially amongst my age group, but the age group of my colleagues that we're speaking to right now. A lot of people were just slapped with the label of a penicillin allergy, and they avoided the medication for pretty much the remainder of their lives. And there's a pretty good chance that you are no longer allergic to the penicillin, especially if you've had a good amount of time pass. So for some reason, time and avoidance to the immune system sometimes works really well, so that it no longer recognizes penicillin as dangerous. And you know, the math is on the side of most of our patients when it comes to things like drug allergy to penicillin. We find that over 80% of people lose their hypersensitivity to penicillin within 10 years. And a lot of the patients that we see, usually people who are adult, they may be needing to find out if they're penicillin allergic or not because they're about to go a dental procedure or a surgical procedure. Maybe worse, maybe they have some sort of an oncologic diagnosis, and it's good to know if we can use the penicillin family in those patients. And we often can be incredibly helpful and figure that out and give them an answer within just a few hours in our clinic.
Yeah, myself included, I had a penicillin allergy. And so in fellowship, we got that ruled out and I no longer do. So if your child has a penicillin allergy, I guess my advice would be to follow Dr. Salacru's advice. And you have a good chance of your kid outgrowing it even before they go off to college. And so don't let them know that there is a great chance that that's going to go away. So great answer. Dr. Scranton, I know that you own dogs and there are patients wanting to know, can I buy a hypoallergenic dog and get away from allergies? Can you comment on that, please?
Yeah, you certainly hear about that, about people and their hypoallergenic pets, talking about hair versus fur and the size of the dog and et cetera. And certainly there are dogs that shed less than others. But again, going back to what I mentioned before about the pollens, it's the stuff you can't see that's causing you the symptoms. It's not the big fat hairs that you find on your clothes that I probably got on my shoes right now with my big dogs. But it's their oils and their secretions, their saliva, their skin flakes. It's the stuff that you can't see with the eye. So So unfortunately, there's no such thing as a low allergen or hypoallergenic breed. Now, you might get lucky dog to dog. You might have one that produces less allergen than others. And you can kind of think of it. I mean, I'm sure we all know people who maybe are or have more dandruff than somebody else, or maybe you have oilier skin than somebody else. And you can kind of think the same thing about dogs. There are going to be some that create more of that allergen than another dog does, but you can't really predict that ahead of time, unfortunately. So if you know your dog allergic, or if you know somebody in your home is dog allergic, I would really counsel you to not have a dog or consider allergy shots, because when you bring that dog into the home, you fall in love with the dog. Everybody loves the dog, and then your allergist tells you to get rid of the dog. and I'm the bad guy, so don't make me be the bad guy.
I love that. I love that.
So it's the smarter thing to do if you know your pet allergic to not have a pet.
Great.
But we can help with shots too.
It's a good license to charge more for the dog too when you put hypoallergenic in front of it.
Yeah, that's probably right. Yeah.
Yeah, good points. A member wants to know, Dr. Salacruz, is stress and allergies linked? How would you answer that question?
That's a great question. I would say there's a very interesting and ancient connection between the immune system and the nervous system. So to quickly say yes to allergies, absolutely. To the immune system and other sort of immune responses, yes as well. One of the things that I did when I was in graduate school, I also got a graduate degree in immunology, and part of my dissertation was looking at the role of stress hormones on immune responses. And what do I mean by sort of stress hormones? Think of when you're immediately stressed, you have a bunch of adrenaline rushing through you. That's a stress hormone. Maybe noradrenaline, what we call norepinephrine. For people who are chronically stressed, we tend to see very elevated levels of something called cortisol. And there are these other stress hormones that we find as well, like neuropeptide Y and a bunch of other really interesting things. And when doing some of this research, we looked at a bunch of different kinds of immune cells, things like T cells and B cells and even mast cells. These are all cells that are sometimes involved in what we see with allergy, might be involved in other immune features too, like certain autoimmune disorders, infections. And we find that these cells have receptors for all these stress hormones. And on top of that, we send, when we're growing up and we're developing, we send a lot of our white blood cells to school. So they go to places, what we call lymphatics or lymphoid tissue. This is school for them. And these lymphoid tissues are directly innervated by the nervous system, and they get very high concentrations of epinephrine and norepinephrine and other things. So it's so odd that there's this connection there. How would it affect the general population? What I found, and what other of my colleagues had found in that academic world, was that if you're exposed to acute and or chronic and or acute on chronic stress, you tend to pull your immune system away from being able to fight viral infections. It may even push us towards a pro-allergic response, which has some really interesting implications. We've been, as a nation, as a nation of the world, we've been stressed for the last 2 years. And so if you pull yourself away, and I'm using now academic parlance here, but if you pull yourself away from this Th1 response, which is the kind of immune strategy you want towards viruses, you lower your circulating certain T lymphocytes, you lower natural killer cells, you make yourself more prone to viral infections. And so that certainly can play a role. And what I recommend to patients is stress management if we can. We live very, very stressful lives. And so for somebody who is experiencing viral infections, recurrent viral infections, part of an explanation could be this very ancient connection between the immune system and our nervous system, and mainly through the expression of these hormones that are circulating through our body.
Interesting. Thanks for sharing that with us. That's
Very interesting.
very interesting. Okay, so I think we have time for one question. I'll answer this, and then if any of my colleagues have anything they want to share, please do. So the question is, my allergy tests were normal, but why do I feel like I have allergies? That's a great question. So sometimes you'll come in and you'll see one of us and we'll test you, and the skin test or even the blood test is completely normal, but yet you suffer during the same times of the year where other people suffer. So here's a couple of thoughts to consider. So one, even if you're not allergic, part of the problem is it could be an irritant. That pollen pollution could be so high, you're breathing it in, your nose doesn't want it there. So it's going to make mucus, and it's going to cause some inflammation and swelling to try to block more from coming in. So you may not be allergic to it, but it could still be kind of a pollution problem. Also, you might find that there's certain other triggers that make your nose more sensitive to make mucus, such as, cold air, changes in the barometric pressure, smells like perfumes, chemicals, fragrances, even eating foods will sometimes, you may have witnessed, make your nose water. And so your nose can be sensitive to more things than just allergies. And that usually is even more common in people as they get more birthdays, like 50-year-olds and up. I often see that more prevalent in this age group, that this starts to happen. And the nice thing is you'll see one of us Allergies, or you'll see your primary care doctor, and we'll talk to you about different treatment options such as saline or nasal sprays. Those are usually more helpful than taking an over-the-counter antihistamine type of pill. We are about out of time. Do any of my colleagues, Dr. Scranton or Dr. Salacru, have any final messages they want to share today with any of these, that as you've been listening, any thoughts come to your mind that you want to say? Anything?
I guess the only thing I would mention as far as allergies across the board, whether it's food or environmental or latex or medication, the primary treatment is avoidance. And so just focusing on avoidance can do you a world of good. Not always fully helpful, but we're certainly here to help you if avoidance alone is not helpful enough.
Thank you. Dr. Salacru, any final thoughts of wisdom you wanted to share?
Yeah, I agree. A great a description of that sort of adult onset rhinitis that you can get, and totally agree. And I hope that for all the people who are listening and part of our healthcare plan, hopefully they don't suffer too much this spring, especially now that we're seeing less and less masking and things are getting better. We hope with the pandemic and with less masking, we start to see a lot more symptoms of allergy come up. So I hope that for all the people out there, they're not suffering too much.
Thank you. So thank you, Dr. Adriano Salacru and Dr. Steven Scranton, for joining us today on Facebook Live. It's been really fun. I'm glad we had such great questions come in. Thank you to those Facebook Live participants, and have a wonderful day and enjoy your spring.
Thanks, Dr. Baker.
Thank you.